Have you noticed that how some of the most significant changes often come after a series of seemingly unrelated events converge? The healthcare industry just experienced 3 seismic shifts within days of each other that signal we reached a critical turning point. These events, a tragic CEO shooting, a controversial insurance policy reversal, and a pending FDA ban, have exposed deep-rooted tension in our healthcare system while simultaneously opening doors for transformational changes.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
Let's talk about the breaking point and understanding the crisis of what we're facing right now. The healthcare industry has reached what appears to be a breaking point, evidenced by unprecedented reaction from the healthcare professionals. The response to UnitedHealthcare CEO Brian Thompson's tragic death revealed something startling, that not just about the event itself, more so noticeable of lack of empathy from healthcare professional standpoint who typically champion the preservation of life above all else. Instead, there is a very little empathy toward this traumatic event. Now, the numbers do tell the story of what's really happening, that UnitedHealth denied nearly 1/3 of all claims, suppressing other insurance denial rate. The insurer's NH prediction algorithm reportedly had a 90% error rate in claims denials. And the company reported over $281 billion in revenue in 2023. So what is the true human impact behind all those numbers? There are 2 sides of this healthcare crisis. As both a practicing cardiothoracic surgery PA and a patient who has to deal with these challenges of getting insurance company pay for the procedures I need for myself, I witnessed our healthcare system's flaw from every angle. The experience has revealed how insurance policies can trap patients in seemingly inescapable situations, much like a lobster pot, easy to enter but nearly impossible to escape. Now, from a patient perspective, my journey going to scheduling surgery illuminates a critical gap in our healthcare system. When my insurance company indicated they would not cover this procedure, I made multiple phone calls myself to seek alternative through the Affordable Care Act marketplace. However, discover a catch-22. Since my surgery was already scheduled, that's considered pre-existing condition, which means no other insurance would accept my coverage. And private paid options, including the life insurance-based health plans, were also unavailable. And waiting period means coverage from the Obamacare would not start until the following month. And ultimately paying more than $8,000 out of pocket for these necessary cares. And there are segmented from the surgeon's payout, the hospital facility payout, as well as anesthesiology group payout. And based on the back and forth conversation, my insurance company, who I spoke to, the agent was telling me percentage of surgery was covered. But when the hospital and my physician was calling my insurance company, they're getting completely different answers. And the frustration continues because it goes on both sides. As clinician, are we providing care that will actually be valued for the care we deliver? And as patients, do I end up with a much larger bill that is unexpected? This experience mirrors countless other people who has trapped in similar situation, highlighting how insurance policies can create virtually inescapable financial burden and binds the patient to the necessary care, yet putting themselves into a financial dilemma. Now, the provider also have the dilemma. From a provider standpoint, I witnessed how billing department was constantly on my case for requirements and pressuring can compromise patient care. They were reviewing how I write my consult notes based on how many diagnosable diseases I have documented on that note. And if it wasn't something that's super clear to them, I need to be very specifically described in the way that I'm providing those care. Now, when we're pressured on adding more and more diagnoses, not only patient feels that some of them are irrelevant and they're getting bigger bill for this treatment, but at the same time, as providers, we become more liable for everything that we're providing and documenting on the chart. So some of the ways that we have been using to judge how well the clinicians are documenting our RVUs, the relative value unit targets. Many of you know this. That's how Medicare, Medicaid determines the value of each procedure, each note, of type of services that we're providing as clinicians, and how well we define documentation for billing. And sometimes the overdiagnosis for patient perspective, they didn't thought they had a disease and it's really difficult to get removed from their chart. Encourage us to overdiagnose to ensure fair compensation and increase liability for providers and compromise the patient-provider relationship and focus more on documentation over the actual care that we're providing for our patients. And at the end of the day, it's an algorithm controversy, technology versus human judgment. The revelation about UnitedHealthcare's NH Predict algorithm represents a broader trend of replacing clinical judgment with automated systems. As a practicing physician, I experienced frustration firsthand when I was seeking procedure approval for my patients as well as diagnostic test or medication through peer-to-peer review, often speaking to reviewers who had been practicing medicine, but in a completely unrelated subspecialty, or they have not been practicing for years, or the lack of understanding of the current subspecialty practices, and making decisions based on algorithm rather than individual patients' needs. The revelation about UnitedHealthcare's NH Predict algorithm exemplifies how technology can exacerbate rather than solve healthcare challenges. And that also means the way those algorithms were built, the information that's been put in there are actually not up to standard and probably has not been updating for a long time. And therefore, garbage being put in, garbage result comes out. And that's driving those 90% errors in denials. This AI system design is allegedly overrode physician approval claims, particularly impacting elderly patients, operated with a staggering 90% error, continued operating despite knowing issues. And that brought us to how do we want to get past this? How do we rebuild what's being broken. It should be focusing on the transparency gap. A lack of mandatory reporting requirement for insurance claim denials creates an accountability vacuum. Without standardized transparency, where comparing insurance performance becomes impossible. Patterns of denials remain hidden, and patients and providers lack data for informed decision-making. And reform efforts lacks concrete evidence. Now, in the current medical system, clinicians become advisors in a way, where we give our patient options. And even the most critical patients that have come to us for heart surgery, we often say, there's option 1, there's option B. What's the pros and cons of each? Now, certain patients still would opt out what we recommended as the best option. Now, some of those decisions are purely based on personal beliefs, family beliefs, and some others are also based on cost. They worry about, despite how critical they are, if they need to get for dental clearance before a heart surgery, for example, they don't have dental insurance. And if anything needs to be done to, let's say, remove a cavity that could become an abscess, but they don't have insurance, then they won't go to do the evaluation even, not mentioning paying for those procedures. And same thing, as critical procedures are done, there are pre-operative testings. And some people would refuse to get them done also because lack of transportation, cost, availability. Now, this dilemma is a social dilemma. At the same time, it's driven by the reimbursement of certain insurance or the denial. And the more time that we have to spend fighting for this denial, then the patient is not getting the care they're needing, and their disease can progress even worse down the line. Now let's talk about our second event that has been happening, the anesthesia crisis, when minutes equals lives. The recent Anthem Blue Cross Blue Shield policies attempt to limit anesthesia's reimbursement highlights a dangerous trend in healthcare decision-making. This situation particularly resonates with healthcare providers who understand that surgical complications don't follow predetermined timelines. Yeah, we might have an average amount of time that we will spend even when we're booking a OR space to say, this is how many hours or minutes that we need for this case. But you can never determine how quick or extend the complication happening during surgery that's going to delay this case to go much longer. Now, what is the impact on patient safety? The proposed policy would have created impossible choices for healthcare providers, which means risking patient safety by rushing the procedure if we really have to keep the exact same time frame and absorb financial losses for necessary care. Then the decline of complicated cases require extended surgical time. What do we do with that? It's for patient to wake up halfway through surgery and in pain, and the trauma that would be if they remember what's been done for them, and the compromises standard of safety protocols. And additionally, financial implication for healthcare providers. The American Society of Anesthesiologists labeled this policy a, quote, cynical money grab, pointing to broader industry trends such as increasing pressure to reduce care costs, growing administrative burdens, rising malpractice risks, and declining reimbursement rates. So there is a trust deficit, especially in this situation that rise by Blue Cross Blue Shield. This incident further erodes the trust between different stakeholders. Providers question insurers' motivations, patients fear financial exposure, hospitals face increased liability, and healthcare innovators struggle with regulatory uncertainty. The healthcare technology paradox is here when innovations meets reality. The controversy surrounding UnitedHealthcare's NH Predict algorithm exposed a critical challenge in healthcare innovation. When artificial intelligence promises efficiency and cost reduction, poorly implemented systems can cause more harm than good. So the reality of AI implementation is that current AI systems in healthcare often override physician decision without clinical context, using outdated or incomplete data set, lack transparency in decision-making process, and prioritizing cost saving over patient outcome. On top of that, the peer review burden have shown us as a practicing clinician, I have seen the review process, even with a human on the other line who's supposed to have a medical degree, often is causing a process that are increasing hours spent on paperwork and phone calls. Discussing with reviewers from unrelated specialties and explaining basic medical concepts to non-practicing physicians. And defining standard of care treatments to administrators, and delaying necessary patient care while waiting for approval. And just like the anesthesiology crisis, a symptom of systemic failure, Blue Cross Blue Shield attempted anesthesiology reimbursement policy highlights how profit-driven healthcare creates impossible choices for clinicians and patients alike. And these clinical impact shows us these proposed policies have affected emergency surgeries require extended time, complicated cases with unpredictable tuitions, and high-risk patients needing careful monitoring, not just rushing things through. And post-op pain management has been a big topic also in recent years, and patient safety during complications, and overall financial ripple effect. Beyond the immediate patient care, the policy threatened hospitals' operation room efficiency, surgical scheduling and planning, provider compensation structure, and hospital facility staff model, which means access to care in underserved areas are going to go up. So what's the third event that has happened? The food industry parallel in adaptation. The FDA pending Red 3 dye ban offers valuable insight for healthcare innovators. These regulatory changes demonstrate how industries must evolve to meet changing safety and effectiveness standard. Red 3 dye has been banned in California and many European countries for years. And now it's about, can we ban for all states across the board? Which means there are immediate business impact. Organizations have to face product reformation costs. Things has to be pulled out of existing shelves that perhaps are popular. Supply chain redistribution and market share uncertainty in the time of when you have to pivot really quickly, and consumer trust challenges, and coming out with all these food and product across the board that they have been consuming for years. How do they trust different manufacturer companies to be able to consume newer products that are safe? And also regulatory compliance expenses. So what are the long-term innovation opportunities? Despite that, if the ban truly take effect, it's not just candy, sodas, and cereals type of food, but it's really across the board agriculture industry. Now, perhaps your product services and your innovation has nothing to do with food and safety, but this also gives you the wake-up call to say, how well can you create pivot and leverage every event for the benefit of your company when something like this comes into play? Policy changes that you have to keep up with the compliance. This change creates openings for natural alternative development, enhancing safety protocol, and the movement of food is medicine. Improve transparency measures, consumer education initiative, and market differentiation strategies, and building what we truly believe can be a sustainable healthcare solution. Now, at Post Point Pass, we advocate for comprehensive approach to healthcare innovation that balances multiple forms of capital, because success is not just measured by revenue or number of patients you can have on your specific plan. Financial capital considerations are important, and they need to be thinking about the revenue cycle optimization, cost-effective care delivery, sustainable growth model, and investment in prevention and value-based implementation. Now, when it comes to intellectual capital development, we also have 5 categories: evidence-based innovation and clinical research integration. That means, how are you making things easier and already in the workflow of what the clinicians and caregivers and patients are doing, and doesn't seem like acting burden? And knowledge sharing platform. Do you have to build a separate platform just to host your data point, or that can be immediately implemented into existing electronic medical record? The more platform you require people to sign in, printing out reports, that is just adding on to the work that they're already doing. It will reduce how quickly people can accept and implement or even keep up with this new behavior that you're asking them to do. And professional development, in the sense of, as individuals, how do we become even better than our best and best practices standards in the way of simple things from onboarding patients or onboarding that staff all the way to supporting higher level for that entire team. Now, human capital investment is also very critical in this standard. The 5 areas we have to consider is providing wellness programs. No matter what, the wellness is not just for our patients, but for ourselves. Just like the employer benefits to the employees, how do we want to create the basic necessity and different type of appreciation languages that you're supporting your staff, your team, and even your peers? And staff retention strategy become even more critical, because for your company to be existing, to be at the place that can outcompete others, or eventually to be able to exit and be acquired by someone else, when you're selling a system, that system includes people. The longer people actually stay with you, the more valuable the investors coming in will understand that these people stay with the company will take to that double, triple, quadruple amount of impact. And leadership development is never a small thing. And that's why for us, we create a high and intense book of you retreat that takes place actually in the middle of the jungle, Costa Rica. Now, we have to be able to detach the existing environment to be able to speed up our progress. And that also means we are in the belief of getting away from the grind and burned out culture, creating that work-life harmony, and understand that it's not about pushing, it's about pulling the right resources and the right people to do something even more amazing. Because then we have the space and the capacity to do more. The next one is social capital enhancement. The 5 categories are, number 1, community engagement. If you're unable to expand your user base, your community support, then despite how many high-end title of board members and people in your company, you're never really quite making it because you're constantly still stay in your smaller community and just competing with everybody else who serve similar results. And next is patient advocacy. Instead of taking away resources, as the previously discussed, cutting down and setting specific time frame for procedures, we also have to think about what the patient actually need and how are the caregivers for those patients need to work together for them to make the specific right progress. And the third is professional networking. How are you actively expanding your professional circle, creating the strategic partnership so people can stand behind you to create what we call the empowered ecosystem? And last but not least, stakeholder collaboration with trusted building. The last couple points are stakeholder collaboration. When you have those entities bring together, what are the specific strategies and plans you can actually move forward with to create better impact? And how do you measure trust building? And how well can you convert that trust into movements? Now, we also understand another capital that's important is culture capital growth, which means your entire organization have to align with values. And that alignment of value is not just something you document to say, this is our mission statement, this is our vision statement, these are the core values. Yes, a lot of hospital and organizations often have yearly trainings. Now, just because you have trainings or you use these values for your employee review based on what they believe things happening aligned with the value and then what the manager or higher end has reviewing of alignment, but sometimes it's also reversal way. Sometimes you also ask your employees to evaluate these values for their leadership. So you're creating transparency. This also need to be included in every single new initiative, offers, and work that you have to do. Number 2, under culture capital is ethical practice standards, which ethics can be reviewed differently, and therefore you need to have a solid group of people who can stand behind you to have those tough conversations. And next is mission-driven operations. Operation efficiency need to have a certain workflow. Now, yes, we become more flexible once a business structure and patient workflow or clinician workflow or backend, things that have been set in place. So then people don't get confused and not knowing what to do, and you tend to not miss a step as you're working through the process. Next is diversity and inclusion. We often promote, just like my recent TED Talk, promoting women-led companies and women become leaders, board members, and become someone who creates change. Not to say it's truly a gender division or even culture division. We've seen that healthcare has many diversified culture at plate, and many international practitioners come to the US and get the corresponding license and help out the system. So it's how do you want to be seen? You're not just your gender, your culture, you're still you, that unique self that plays a critical role in the community, in this organization that you choose to be part of. So what does that mean to be you? And how do we allow the individual person and that emerges with the whole culture of your organization and your company. Last but not least, environmental responsibility. How are we creating sustainability from the community's perspective and including every other aspect of this environment that we created? Now, let's talk about the path forward. Let's create meaningful changes. Healthcare leaders must focus on immediate actions, such as implementing transparent AI systems. Share how you're creating those algorithms, getting people who are the experts in the area to help modify them, and develop fair reimbursement models, establish clear clinical guidelines. Ask the experts in the industry to create those guidelines, then rewrite into your AI system, and creating effective oversight mechanisms. It's when we don't have the quality control in place, often things, despite how many structure you have created, it fell through and created errors. And some of the long-term strategy we need to focus on is investing in, there's a shift in monitoring patient from a distance, whether it is early discharge or relatively healthy patients who need to have better education and understanding their condition when they're not with us in a clinic or in a hospital. Developing sustainable business models and not cutting corners, and fostering innovative partnership. Not just talk about let's collaborate with your trusted partner, but actually have a plan in place with specific time frame and actions. Enhancing patient engagement. How are you thinking in the patient's perspective and caregiver perspective, and doesn't feel like they're the last person to be engaging in the conversation while all the decisions are being made, whether that's from a payer perspective, health systems, employers, and even individual caregiver teams that's supporting these individual patients, and building resilient healthcare system. And resiliency really is about an ecosystem that have more space, more joy, more health. How can you have these places that create inner joy, inner motivation that people want to be and want to get, not but simply because the passion and mission aligns with them that drive things forward. So we actually have a lot of amazing opportunity for innovation right now. And the current climate represents unique opportunity for technology companies to develop ethical AI solutions. And healthcare providers can create more effective delivery models. And insurers designing transparent coverage system. And because when things are clear and understood, there's no question. And that's where you get trusted partners, people, providers, clinical team, patients, advocacy groups stand behind you. And investors supporting sustainable healthcare solutions will be even higher. And which means entrepreneurs, innovators, you can address systematic inefficiency. So what is our call to action right now is how we can revolutionize the healthcare system. And we invite you as innovators to share your solutions through our Post-Point Path Annual Impact Award. We know there are amazing things happening right now. And many of you has great testimonials, systems, clients, patients already using your services and product. And you deserve to be spotlighted because you're making positive movements in healthcare, and collaborate with other like-minded organizations, getting the right shout outs and people behind you, increase your community engagement, and ultimately having the right mission-driven investors to open the wallet for you. So go to pulsepointpass.com/to showcase your innovative solutions. Deadline is December 20th, 2024. With the right resource, you can scale your impact much faster. So we encourage everyone to create discussion dialogues around how is your organization addressing these healthcare system challenges? And what innovative solutions are you developing? Share with us in the comments below, wherever you're watching and listening to this, or post on LinkedIn, tag me, Sabrina Runbeck. And best, let's give you the proper media shout out by putting you on multiple podcasts and press releases by applying to our Impact Awards. And tell us what strategies have proven effective in your experience. Let's work together to create a healthcare system that truly serves everyone while maintaining financial sustainability and ethical practice. Share your thoughts below. We would love to hear your input.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.